All right, let's see if we are doing this right. Hello, everybody. Hopefully we're live right now, and otherwise we're talking to ourselves.
Yeah.
Which gets awkward really fast. So all right, we see some people on there that are watching. So welcome to everybody. Thank you for being with us today. We'll wait just a bit while people get on because we see people jumping on here. We're also trying to figure out technology, so give us just a sec.
I can't see comments.
Oh, go to the post from earlier. See, we're just figuring out this stuff. No big deal.
Sorry.
We're technological geniuses. Yeah, and then go to comments from there. Destiny's going to watch your comments from earlier, and then we're also going to watch the comments on the screen and try to answer any questions that come up today. So we've got about 30 people here. We'll give it a minute or two. And if you do have any questions, feel free to post it on the comments on this live feed, or you can post it on the post from earlier. Post it on the post. That's weird. But from earlier today, and we'll be happy to watch those as well. So, all right. Got about 36, 38 people. This is like the most attention we've gotten in a long time.
Yeah.
We're very excited.
So excited.
Hello, I see some hellos and some how you doing? How you doing right back? And we will start in just a bit.
Okay.
Yep. All right. We're going to adjust this because, it's basically a live selfie and we want to make sure we're positioned right. Very important stuff. Hello. Nice to see some of you guys. Hello. Thanks for the hellos. Man, we jumped up to 57 people. This is great.
That's awesome. Did we say we were going to do?
Alrighty. What time do we have? 3 or 5:30?
5:32.
60 people. All right.
That's cool.
Oh,
That's
Cassie's on there. My sister's watching.
My husband's on there. I
All right.
saw his name go by.
Okay.
I miss you and your dad.
Nice. All right, you guys, we'll go ahead and get started. Let's introduce ourselves first. This is our first attempt at this live business, and we're just trying to do our best for you. So I'm going to start out by saying I'm Jennifer Bacani McKinney, and I am a family physician in Fredonia. I'm the Wilson County Health Officer. I know there are some people from out of town on here, so we're going to try to inform everybody of what we're doing. So you might have heard a lot from us. You might already be sick of us, but in case anyone is watching or hearing from us for the first time, then we're gonna give you our whole spiels. So I'm the Wilson County Health Officer.
I'm Destiny Wheeler. I'm the Health Department Administrator here for the county.
All right. And can everyone hear us okay? Can someone give me a thumbs up on the comments or a comment of whether you can hear us or not? We'll give it just a second. Oh, that's so nice. Thanks, Miss Baker. All right. Okay, I see some thumbs ups there. Thank you, guys. Awesome. All right. So, thank you. We're going to start out, we're just going to go with a little bit of what we're doing today. Our purpose today is that we know there's a lot happening, and every single day things are changing for us in the healthcare field, for the schools, for the state, for the country, for the world, and it's hard to keep up. And what we're trying to do is gather that information for you. We know that not everybody has time to read the CDC website, read KDHE. We want to try to consolidate that information for you and give you the best information possible. So we want to be your information source. We by no means know everything, even though sometimes I claim that at home, and that's okay. But we want to make sure that we're sharing the information we know. Our goal is for us to know as much as you know, and for you to know as much as we know. Everything is transparent. We're not hiding anything, and we want to make sure everybody feels as comfortable as possible. Because we also know that fear can come from the unknown. Fear can come from when we hear rumors and you hear, you don't know what is fact, because there's a lot of information on social media and on TV. So we want to be here for you, and that's our goal. If this is helpful, we'll do this regularly, once or twice a week. If it's not helpful, then we'll stop, we promise. And eventually you'll get sick of us, but we'd rather over inform you than the opposite. So What would you like to start with today, Destiny?
Okay, well, so the main focus of public health right now, and especially public health in Wilson County, is around social distancing. And we know that this term has been pushed out, and we're saying it all the time. Everyone's saying it all the time. And so I think that's probably where we should start. We're doing a lot of great things in the county. I know the hospitals are doing a really good job of keeping people separated in doctor's office, and clinics are doing a really good job of keeping people separated in waiting areas. Of course, school decisions lately have created social distancing. The restaurants and everything are pushing people farther apart. So what social distancing means is not that you don't ever go out of your house or you don't ever interact with one another, but you do so safely and you do so at a reasonable distance. For the case of the novel coronavirus, the exposure level is for the normal person 6 feet apart or within 6 feet of someone for 10 minutes or more. So we want to reduce that type of exposure as much as possible.
Mm-hmm. And the whole reason that they have, there's nothing magic about 6 feet and 10 minutes, right? But we have to have some sort of way to differentiate between casual exposure. Like if Destiny gets diagnosed with COVID, then if I just happen to walk by her in a hallway, I don't want to assume that I've been exposed. So that's why they give us those guidelines of 6 feet and 10 minutes. Now, if I'm in an exam room with somebody and they're coughing and there's some droplets going all over the place, then potentially I could only spend a minute or two with that person, and that would still be exposure. So we have to use our judgment on that, but we have to have some guidelines to start with. Oh, sorry.
No, go ahead.
Destiny mentioned that our county is doing some really great things, and I really wanted to say that we are both so proud of our county. Destiny, I don't know if you know that she's world famous now, but our health department is kicking butt. See, we're censoring today because I don't know who's all watching, but our health department is doing great. Destiny was featured on NPR and the health department along with Cassie because they've been working on this for weeks before and months really before we ever started, kind of ramping up our efforts. So here in Little Fredonia and Wilson County and Neodesha, Altoona, all of our surrounding towns, we are staying on top of things. We've been meeting as a county with the hospitals, the schools, EMS, home health, the police departments, everyone you can think of. And just the fact that we're getting together and talking is amazing because other places maybe aren't even doing that yet. And we were kind of ahead of the game with that. So I feel pretty confident in our leadership in our county, in our health department, in our schools, in everybody that's working really hard for our county. So great job, Wilson County, and we're happy to share any of our information with other counties or other states that might be listening.
Yeah. So,
can we do that one?
Yes. There was a question from earlier on our post where we announced this, asking if testing is available in Wilson County, and it absolutely is. We've actually tested 3 individuals. One of those was negative, and 2 results are still pending. So we don't have answers on those. Those that are still pending are quarantined or isolated away from people in their homes. So we're not gonna say anything, about them or anything, but or their situation, but they're not out roaming around in the public, so they're not spreading it around.
Des, in general, I think people have been very receptive to quarantine and self-quarantine. Yes. Would you agree?
Yes, absolutely. We those folks that have been traveling both abroad and to places in the nation that are higher risk areas, Washington State, certain counties in Colorado, and New York specifically, are asked to quarantine for 14 days upon their return. That 14 days will cover the incubation period, and so if they don't show any symptoms, then they're fine to move around the county however they wish. And then they I lost my train of thought. Sorry, I answered a question or looked at a question. If they do develop symptoms during that 14-day quarantine, then they're asked to call their physician and set up an appointment with them to be tested or to
determine,
I guess, if they need to be tested. While I'm on here, those individuals are not required to contact the health department. But as the health department administrator, I would like to ask them if they would not mind doing that, to please do it. It is simply for our planning purposes. If we know how many people are self-quarantined in the county, then we kind of know what the situation we're looking at is, the travel situation, and we kind of better know how to plan. So again, we're not going to get in your business or anything. Just let us know if you don't mind.
So speaking of contacting your doctor and quarantine and all that, I know it can be really confusing. And for us, we're still, we talk every second now. I think we're actually related now, Destiny and I, because we talk so much. But what we're finding is that there are some gray areas, and there's great guidance from the CDC and from the state. But if somebody is exposed to somebody who was exposed, does that person go into quarantine? Call us and we'll help figure that out. One of the biggest things I want to mention today is, as far as businesses and employers, there's a lot of question about what an employer should do. Our overarching message would be that the employer's job is to make sure that the employee that might be ill goes home. That's it. We do not want the employer to feel like they have to decide if a patient or if a person needs testing or, what the next steps are. Do they need to be quarantined? Your only job as an employer is to determine or to make sure that a patient who is ill, with fever or without, but respiratory symptoms, GI symptoms, whatever it is, you want to make sure that they go home. And then that employee's job is to make sure that they contact their doctor. And then that is where we come in and we talk with Destiny, we talk with our team, and we determine if the employee needs to be tested, if they need to come in, if they're at risk for coronavirus, if they're at risk for something else. There's a lot of other stuff going on out there, allergies, different colds, different viruses, strep throat, all kinds of things. So that's our job to be able to tell you what the next step is. But we're also asking that our employers are lenient with their sick leave policies. Some of the rumors out there, and we don't know, is that employers everywhere, and we're not just saying in Wilson County, but employers are maybe discouraging people from going home sick, or those employees are worried that if they do go home sick, they're automatically going to be off for 14 days. And we know that can be a financial strain for people. So what we want to do is we want to make your job easy as an employer, as an employee. If you are sick, please go home. Employers, please send them home. And employees, call your doctor as soon as you get home, or as soon as you decide that you're sick, or when you get home, and let us know. And we'll work together as a team to figure out what the best course of action is.
And along with that, employers, if you are able to make your attendance policies a little bit less strict at this time, if you have a point policy or, only so many absences, only so many days at a time, it would be nice if you would reduce those down to make it a little easier for people to stay home and not feel like they need to come to work sick to avoid losing their job. So.
And there is legislation out there, federal legislation, but although it hasn't passed at this point, because we want people to feel comfortable, but we know that's a financial strain. If that does pass, hopefully that's going to help some of these businesses that have seen their revenue decrease because of all this, and when they have employees that go home, and we know that can equal lost revenue. Another comment here from Sabrina is that employers, please don't ask your employees for a note. Agreed. We are. Honestly, I've instructed my staff to give out notes if that's required, that they talked with the doctor, but they don't have to be seen. If a patient says that they need a note saying that they talked to the doctor, that's completely fine. But we do not want to see people in the office just to prove that they were seen by a doctor or they consulted a doctor. That just increases the risk of exposure to the patient and to the healthcare team. So agree that if we can do away with doctor's notes for now. We understand that the world is not perfect, and people might take advantage of this situation. In the end, we hope that people will be honest, and that they will use this time to help each other and keep each other safe. Anyways, how are we looking? Anything else there?
Okay. Go ahead. Yeah.
Yeah, there were a couple other questions. Can it only be spread by coughing and sneezing? This is, as far as we know, and there is some. I mean, there's still some ideas out there that this could have some airborne components to it. But in general, what we know is that it is spread by droplets. What that means is it's kind of the difference between the flu and cold, the different colds that are out there each year, that if you cough or sneeze and your spit goes flying everywhere or whatever, that, and somebody then touches it, and then, they're touching their stuff, like, I'm infecting destiny. But that's when the disease gets spread. If we're just breathing the same air, that's not how it's getting spread. So as far as we know, again, everything is evolving each day. So that's why it's so important to wash your hands, to clean all the surfaces, to not touch your face, because it takes that extra contact, from one person spreading it to the other person receiving it to be able to contract that.
So there was a question about why specific Colorado counties are being included in the quarantine request, and it's because there is community transmission there. And when I say that, it means that when cases very first come into the state or into a specific area, they've usually been somewhere, gotten it, and come home. And so then we can keep control of that one person. And, not control, that was a bad way to say that. We can keep an eye on that person, and we can take care of them, and we know where they are pretty much until they get better. Well, if that person goes out and these people all, if it's circulating in the community, then it's more of a danger to the people in that community. And in those specific cases in Colorado, there's more widespread community spread. So that's why those counties in Colorado, because there's community spread in those counties.
And yes, it's always good to sanitize no matter what you're touching. Children are dirty. Wash your hands after you touch a child, any child. My children, your children, any children.
Any children.
There was a question to go on with the community transmission. It is now believed that in Johnson County there is community transmission.
Yes.
And so that's really important to know. Someone, Cabrini, commented that that COVID-19 is so widespread in Johnson County that they're presuming a person has it if they display symptoms, and then asking them to self-isolate. And those around them to self-quarantine. Really great point, because
Yes.
What we know is that 80% of the people who have this disease are going to end up with mild disease. And so rather than using test kits that we are already in short supply with, and maybe the hospital beds that need to be saved for people with more severe disease, people are asked to self-quarantine or isolate at home. Mm-hmm. So it's true. And so it's, just because there's not widespread testing at this point, and we don't know if that will ever be the case, that we're just going to test everybody, probably not. It's because we know that the treatment still is home isolation. And we do that. This goes into another question about, should we be concerned with the potential for hospitals to hit capacity? Absolutely.
Yeah.
That's the whole idea behind flattening the curve, if you've seen that graphic. We have 40 beds in Wilson County, and I believe one ventilator, and so if maybe two.
I think maybe two, but
maybe two.
Not enough.
Not enough is the point. 40 beds is for the number of people who are expected to have severe disease. That is not enough beds for those people.
No, not all at one time.
Not all
at one time, and that's why the social distancing hopefully will slow the spread of the disease, and flatten, like Jen said, flatten out that curve, so those cases come in smaller increments so that the healthcare system can handle it.
Mm-hmm, absolutely. We do know that some of the thought behind how many people are going to contract this disease before it ends, the idea is that by the time we hit about 30 to 40% in a community, we start seeing some herd immunity there. And so it's not going to be that everybody gets this disease through the course of its lifespan. But if we get to 30 or 40% all at once, and we just overwhelm the healthcare system versus 30 to 40% over the long course, that's the difference between, well, not to be dramatic, but lives being saved, you know. So that's why the social distancing is so important for everybody.
Yeah. So there was a comment about anxiety and that information helps with that, and that's great. That's really what we want to do here. We're really trying to keep everyone informed. I can tell you this is out of my comfort zone. So
I maybe talked her into doing this, but look how great she's doing.
Yeah.
So good.
So Deb Wells had a question about what we would tell our kids and grandkids, and I would encourage you to be as transparent with them as you can. I mean, we know they don't understand all of this stuff, but tell them there's a virus. Tell them it's to keep everyone safe. You know, be honest with them. That's my advice. I'm not a child psychologist, but you know, there's anxiety for kids when things change, and things are obviously changing. So, you know, in the same way that there's anxiety for us when things change, it does help to give them information that they understand.
And there is a great link on the CDC website, cdc.gov, that says how to talk to your children about COVID-19. So if you don't want to do it and they can read, just hand it to them. Just kidding. It's just guidance. Or teach them to read with all this time off of school. Again, just joking. We're doing some good information here. So, but please do be very transparent with them so that they understand and teach them the best that they can not to touch their face and how to wash their hands and keep other people safe as well. Another question was, do you want to talk about test kits? Why are they in short supply?
So test kits are in short supply worldwide because there have been a lot of tests done worldwide. And so yes, they're in short supply, but we really hope that the reason that we're testing in the way that we are is to conserve those supplies and best use them in the most efficient way. So, do I go into testing?
Sure, why not? Let's talk about testing.
Okay, so if you call your doctor first.
Yes, do not show up at your doctor's office or the ER for, always call first. That is our other big overarching theme.
Yeah.
Do not just show up. Call first and then let them know that you're concerned about coronavirus, and then we'll be able to screen you over the phone first.
Yes, and then if you are symptomatic, there's a possibility of 3 tests for you. Your doctor's going to evaluate you. They're going to do a rapid flu swab, because the odds of you having influenza and coronavirus at the same time are very, very, very low. So they're going to do a rapid flu swab first because it's not horribly expensive. Secondly, if that comes back positive, they're going to send you home because you have influenza.
And your likelihood of having influenza and coronavirus or anything all these rhinovirus, parainfluenza virus, the likelihood of co-infection with also coronavirus is very, very low worldwide. Sorry, go ahead.
Nope, you're fine. So then once that test is done, if it comes back negative, they're going to do a respiratory panel on you. They're going to swab your brain.
Yes.
They're going to stir it around and they're going to swab your brain. It's not your brain, but it's a long ways back there.
It feels like your brain.
Yeah. So then they're going to take that test and they're going to run a respiratory panel on it. If everything on there is negative, then they can send that swab in to be tested for COVID-19. So there's an interesting way to test, but it does conserve tests. Mm-hmm. So we're not just going out testing everyone. We just don't have the supply for that. No one really has the supply for that. So that's why, yes, there's a shortage of tests, but we're really trying to use them in the most efficient way.
And you might get tested in your car out in the parking lot, or we might test you real quick in a room and send you right home and say, just wait until we call you next. We're trying to keep people who are sick potentially away from other people. So I think another question might be, How long does it take for the testing to come back? So what we know is that if we get tested, or if we test through the state, we have to get approval from the state to test through the state. The benefit of the state testing is that we get results in about 24 hours.
24 hours from when they receive the test. Yeah, so we have to take it to them, and then in 24 hours we should have a result.
Yep. And then if we don't get approved by the state, and that means that you don't meet the criteria, we love all these comments, by the way. We're reading them and like trying to keep like our serious straight faces. These are our professional
serious faces.
When we call the state, if they don't approve a test, the reason they wouldn't approve it is if you don't meet the criteria. And currently the criteria is, hopefully everybody's taking notes. There's going to be a great test afterwards. It's going to be so good. But the current criteria is if you have come into contact with somebody with confirmed coronavirus, COVID-19, right? If they have to have been confirmed, working fine. Okay, we're good.
That's good.
All right, sorry. Hopefully everyone's still there. So somebody who has been confirmed with COVID-19, if you have come into contact with them within the last 14 days, and you have fever or respiratory symptoms, then you are what we call a person of investigation, under investigation, a PUI, a PUI. Do we do that? PUI. So, or the other option would be if you have a history of travel, and that could be pretty much anywhere these days, right? Like, kind of.
Yeah.
And you have a fever and respiratory symptoms. So that's travel and fever and respiratory symptoms. You've been in contact with somebody with confirmed coronavirus, and you also have fever or respiratory symptoms, or the other option, right? So that's where the testing would be approved through the state. And if not, our other option is.
Well, first I want to say,
yes.
You are not going to get tested if you do not have symptoms.
Oh yes,
that is really
great
important.
Yes.
If you just think that you came in contact with coronavirus, stay home. We cannot test you.
Yeah. Great point. Yes.
Oh, yeah.
No, that's good. Sorry. And we're very easily distracted. Like,
no,
let's just keep reading.
One.
You guys are really entertaining too. I don't even know. Like, not that we're necessarily entertaining, but we're trying our best. So, my brother's chiming in. They've got some testing coming next week. We can also test through Quest and LabCorp. So that's a send-out test that takes about 72 hours to come back. So there are ways to test outside of the state's approval. But again, we're not going to test you unless you have symptoms.
Yeah.
So, let's see, I think there was another question about, what?
I think I was trying to catch them all.
Other questions? We see really great comments.
One thing that I figured would give like a numbers update for
please.
Kansas. Kansas has 21 cases right now. The majority of those are in Johnson County. We're also treating 2 people from other states. So they're actually in Kansas, but they don't get counted as Kansas cases because they aren't here. So 21 cases plus the 2 non-residents.
Yeah. One question here from Eric, thank you. What respiratory symptoms should we be looking for? And there's another one. So when we talk about respiratory symptoms, we talk about cough or shortness of breath, but it's hard because it's not always those things.
Yeah, we've heard sore throat. I've heard sore throat,
body aches,
yeah. headache.
And then we have lower respiratory symptoms, the more severe ones like pneumonia or respiratory distress or shortness of breath where you can't catch your breath. Mm-hmm. Those are kind of what we would call more of the lower respiratory symptoms. So very important to know. Again, don't be shy though. If you aren't sure, call your doctor and we can help figure that out with you. If you aren't sure if your symptoms count as respiratory symptoms, if it's something that we see with coronavirus. We aren't seeing as much nausea, vomiting, diarrhea, thank goodness, because we don't have enough toilet paper for that at this time. But you're supposed to laugh at my jokes and pay attention.
I'm sorry, I'm trying to read these comments.
I swear, come on, people. Hopefully, but hopefully we're playing along at home. But you can have GI symptoms. So even though that's not the most common thing, if you end up with nausea, vomiting, and diarrhea, please let us know, and we can help decide if what kind of testing that you might need.
Yeah. Do you want to answer the vitamin? What was that?
Yeah, there was a question about
treatment
from Joel, Pastor Joel. I hope it's okay that I told you that you asked a question, or told them that you asked a question. So, but there's just so much information out there that it's fair game to ask anything. There's something about ibuprofen too.
That's what it was. Does it exacerbate?
So, there are people who believe in vitamin C infusions, things like that. At this time, we don't have any evidence that shows that is something that's helpful to do, like a vitamin C infusion. So don't do that. Please stay healthy. We still, everybody's immune system is better if you are eating well, exercising, getting plenty of sleep, drinking plenty of water. I mean, the same thing that we tell people all the time. So stay healthy. Hopefully St. Patrick's Day was mild for everybody, since everybody was kind of social distancing. But please, just stay healthy, and that's kind of going to be your best defense, along with washing your hands and not touching your face. I can scratch my head as I'm doing that. Yeah.
There was a question, and a very good question. How are you supposed to know if you've been in contact if the incubation period is so long?
It's a great question.
It's a great question. That's why we're trying to implement these quarantine measures for high-risk people, before they actually come in contact with people and before they develop symptoms. So yes, it makes it much more difficult. Symptom onset is often around 5 to 8 days. Even though the incubation period can be longer. So a lot of times that's not, you have a little bit less time, but it's really important to really try and keep yourself distanced from people if you know that you've been somewhere where it's spreading.
So we have a really great comment from the other Dr. Bakani. Wait, I think I'm confused because my brother did go to school as long as I did, but doesn't have a doctor. Just kidding, Dodie. Hi. He mentions vegetable juice like vodka, which is really potato juice. Thank you for your very valuable information. There's a question about, does it harm your heart if you had valve replacement? The answer, I think, that I would give to that, or do you want?
I would say, does it harm your heart? I would say that puts you in a higher risk group for serious disease. We see worldwide that number-wise, those most at risk are people over 65 and people with underlying health conditions like heart disease, diabetes, lung disease. Am I missing?
Heart disease, diabetes, like cancer.
Cancer. There we go.
Always cancer.
Yeah. So anyone with suppressed immune system really needs to be careful at this point, and that's just worldwide. So I would say, I don't know if it harms your heart, but it definitely gives you more of a risk to have serious complications to the disease.
Yep. There's a question about, are all the doctors able to test here in Fredonia? And also there's another question about, why wouldn't we proactively test, considering all the information we have? The proactively testing, I believe, is where we have a shortage of tests. Would be the issue that we have to be kind of choosy with testing people that are symptomatic and quarantining people who may have may be at a higher risk or because they possibly came into exposure with somebody. So unfortunately, I mean, we're already seeing in the state and around the country that people are without tests. I've heard many of my family doc friends out there saying that they can't get kits or they can't get tests, and we're fortunate in Wilson County to have plenty of tests at this time, but we want to make sure that stays the case, because we've got a long haul ahead of us too.
Yes, and Bridget, yes, asthma is one of the lung diseases that is worse, and yes, all of the doctors here are able to test. I know for sure the hospital in Neodesha, and I think all the doctors can too. Yeah, so every doctor in the county can test.
Yep. There is a question about Advil and ibuprofen. Something came out today that they actually are saying not to use ibuprofen with COVID-19. I cannot give you right now all the information on that and all of the chemistry and biology behind it, but I will be happy to have that ready for next time. So
we'll make a note.
And let's see, this is another one about ibuprofen. And so Tylenol. Tylenol is not the same as NSAIDs, and so acetaminophen or Tylenol would be helpful in this case if you're having aches and pains. Steve, I don't believe this is a question, but if it is, yes, I think we are awesome.
We are, yeah.
Thank you.
You're right. Thanks, Steve.
Just kidding. We're also very humble.
Yes, yes. So
What time are we at, people?
we're 5
Oh,
minutes past our time, but we
Okay.
started 5 minutes late, so that's okay.
We did, yeah. Other questions? We've still got 100 people on here. Again, our goal, and we know people have kind of jumped in later in the conversation, so please feel free to repeat any questions because we want to make sure that everybody feels good about the knowledge they have about this disease. One thing that we believe in kind of the public health arena, some of the feedback we've gotten is, man, is this really that big of a deal? You know, are we just overreacting? What we believe about that is that if we overreact and nothing happens and people are safe and it's not as big of a deal as what we thought, then we did our job. We did our job.
Yeah.
And people can say, man, you guys really overreacted, and we're okay with that. We are okay with saying that we did more than what we needed to do. The flip side is if people come back after all of this is done and they say, we wish you would have done more, that's where we couldn't probably forgive ourselves about that. So we're happy to overreact. Overreacting and preparing doesn't mean that you have to panic about anything. It doesn't mean that we're trying to cause people to be scared. It means that we're doing everything we possibly can to keep the people safe in our county and our communities that we possibly can.
Yes. And as far as the outlook for the next 45 days, I think it will be an interesting 45 days. We really will continue this social distancing mantra that we've been pitching here, and hopefully that will mean that not much will happen in the next 45
Exactly.
days, but I can't say that.
And you know, when you mentioned
kind of a guess.
a question, kind of a follow-up question about is the worst over with, I don't believe that. I think we're kind of at the beginning of it here in Kansas still. So we have, I guess, the luxury of, if you can call it that, seeing kind of our future with the other countries and what they have going on. So we can see other people social distancing. We can see people not social distancing and see what happens in those countries when each of those things happen. And so if we are observant and we see and you know, we look at the worldview of what's going on, that will help guide us in what we need to do in our own communities. So that's why we're so adamant about social distancing, closing schools, or not closing schools, but keeping the children out of the buildings, because we know that has helped in other countries to be able to slow the spread anyway. So I don't think by any means that this is the worst of it. I think the worst is still ahead. You know, there's talk of this could be around for 18 months. The worst could be in 4 to 6 weeks. We could be done by 6 months. Nobody knows, but if we keep doing what we're doing, we're going to give ourselves the best chances, I believe.
Yeah, the epidemiologists that are advising health department officials, they're projecting waves. So waves of outbreaks, and so you know the West Coast is having their wave, the East Coast is having their wave, and I think those waves will work themselves inward. Hopefully, we will learn enough about the disease by the time it gets here, and we'll already have these social distancing plans and procedures happening, so that maybe a wave won't happen here, and that's our hope.
I mean, I think that we can just sacrifice all the New Yorkers and just see what happens. Just kidding. I know I have some New York doctors on here. So. But no, don't sacrifice anybody. I think we're adamantly against that, is what I'm told. You know, Eric, you ask why is there such a reaction to this, but not like the H1N1 or other new viruses that we have gone through in recent history. Let's kind of tag team on this one, because I think there's a lot of information or a lot of question in that question. This is a big deal because we are seeing high fatality rates, you know, so it's affecting the older people the most, but we're seeing it transmitted from the kids to the older people very easily. So when we see what we're logging right now is fatality rates of 3 to 4%, you know, from what we can see, and other doctors on here, please feel free to correct if we're just making stuff up. But in some of the worst flu epidemics, we were seeing things like 2% or less fatality rates. Additionally, we have no immunity to this coronavirus. And Destiny, you can talk more about that.
I was going to say, so H1N1 was a flu, which was kind of lucky because we already make a flu vaccine. So there was already a base for that vaccine. We just had to change the strain. That's why the year the H1N1 came out, my first year in public health, by the way, they made a flu vaccine that they were already manufacturing, and then they had an H1N1 vaccine as well. If you guys remember, you got 2 flu shots that year. Mm-hmm. And there is no vaccine for a coronavirus. So in humans, mm-hmm. there is in cattle, but mm-hmm. not in humans. There's not a human vaccine. So we were able to use vaccination and herd immunity to protect us during H1N1, and that's not an option here because there's no vaccine for it. They're trying to make one, and that would be fantastic if they get it done. But that's a totally kind of a different animal.
And you may have, people say, well, I might have had the coronavirus before, or I've heard it's been around for a while. And Joel, yeah, eat more beef. Yes, if you want. and also not IV vitamin C, because we don't have any research on that one, just to reiterate that one. But there have been coronaviruses around for forever, for decades, but those were different. This is a different virus completely. The SARS virus back in the day, that was a coronavirus also. So if you think you had it before, you didn't have this one. So this is brand new, hot off the presses. Yeah. So welcome to the new coronavirus. Let's see, slippery transmission, absolutely. If we didn't hit a question that you asked, please restate it because we might have scrolled past it.
And can we go back and look at them?
Yeah.
So we can go back and look at these questions. So if we missed anything, we'll get it answered.
Oh yes, vaccines for cows, eat more beef. Okay, I'm with you.
I knew what he meant.
We're not telling you to not eat more beef. How about that?
So while we're on here and everything, is this something that's helpful? Is this something that we should do again, weekly or?
And yeah, just comment in the comments, or we see some thumbs up. That's thumbs ups. Thumbs ups. So we will be happy to do this. We want to keep people informed. Yes, Shani, your boss is awesome. Thank you. What we know that every day we're getting new information. So updates from the state, travel advisory. So go to the KDHE website, go to the cdc.gov website. Those are the places where we're looking all the time. Mm-hmm. Travel advisory, that was what Destiny mentioned earlier. Schools closing until the end of the school year. We don't know what that looks like afterwards because we don't know how long this is going to hang out. Are we going to be back in school in August? We're not sure. But I can tell you that our schools and our school district are amazing, that they have already been planning for this for weeks. They already have plans for feeding all the kids in Wilson County. If you don't already know, hopefully you heard already that our schools are going to have 3 in Fredonia. Sorry, I can speak about this, but in Fredonia, and I know Altoona and Neodesha are doing similar things, but they can feed kids age 1 to 18, even if they're not in school. The kid has to be present to pick up the meal, but we'll have pickups at the elementary school, the high school, and also in the G&W parking lot. Like I said, in the other communities, they're doing similar things. Yeah. Adults can actually, in Fredonia at least, can buy meals as well, a lunch and a breakfast for $5. So, man, how great is this community? We're so good.
Really good.
I mean, I'm
really
just so happy. So, lots of good stuff. People are, good. We're happy that people are feeling more calm and less anxiety. That's kind of what our point is to ease everyone's minds, that we are trying our best, and Wilson County really is doing amazing things, and we're so proud of what we're doing.
Yeah, so I would say we'll leave you with the advice of...
One other state mandate was that they aren't going to be shutting down utilities or internet. Oh, yeah. So don't pay your bills. Just kidding. Pay your bills. That's irresponsible. But
pay your bills if you can, but if you can't, don't go to work just so you can pay your bills.
That's our point.
Yeah.
The people at the state and national levels understand what we're going through, financially and health-wise, and so they're trying to help us out in all these different arenas.
Yeah. So I was going to say, the thought we can leave you with is, if in doubt, quarantine when you can.
We should have something more rhymey.
We should, but that
We'll
was
work
just-
on that for next
Yeah,
time.
yeah.
So we will post when our next Facebook Live session will be. I don't know when it'll be, but especially if there are big updates that that happen, then we will probably jump back on here. Yes, for internet.
Thank you. Thank
There
you,
was
Joel.
something about, let's see. Wouldn't people be more likely to follow quarantine recommendations if more testing was done to know hotspots and who actually is positive for COVID? If it's a maybe, especially young people are going to ignore the recommendations. Totally, it's hard. Like if we could test everybody, or everybody, as people say these days in songs. If we could test, I know they're never going to let us back on here.
No, if we could test everyone, we absolutely would. We just can't. And especially in a town like this, we have a full-time health department staff of 4. So we cannot track everyone in the county. So we're hoping for the honor system. We're hoping that people will do what they're supposed to do. And if they don't, we're hoping everyone else stays far enough away from them that it doesn't matter as much, that it doesn't have as big of an impact.
And we've got a when in doubt, camp out. Good job,
There you
Brooke.
go.
We're loving it. T-shirts to come.
Yeah.
Also, Destiny was exactly right. I mean, when in doubt, quarantine or camp out. But also contact your doctor, contact the health department if you have any questions. We're here for you. We will always be here for you. We love you.
We're gonna
We
stop
love
that.
you all.
We're going to stop that right
Okay,
now.
okay,
So the one other thing I wanted to mention was if you go to your doctor or the hospitals, they are screening when people walk in the door. They're going to ask you if you have a fever, they're going to ask you if you have a cough, and they're going to ask you if you've been traveling. So what they're asking you those for is to see if you are one of those people that could have the disease, and they're going to put a mask on you to protect the other people that are here and the healthcare workers. So please, please leave those masks on and answer honestly.
Yes, answer honestly. Don't fake not having a fever.
Yeah.
We'll find out.
Yeah.
And in general public, don't wear masks. We don't have actually like a whole lot of masks. So will you say one more thing, please? Sabrina, let us know what you want us to say. We'll say it, probably.
We keep saying, one more thing.
One more thing. But we actually don't have a lot of masks. And so don't go out there and buy a whole bunch of masks and use all the masks because we also need them to take care of you guys. Nate, yes, good call. Class of 98 forever.
We almost wore our shirts.
Sorry, we already...
We
we'll
sanitized
later. Okay. People still have normal emergencies like heart attacks, etc. So if chest pain, shortness of breath, go to the ER.
Yes,
Absolutely. Great
absolutely.
call. How many tests have been done in Wilson County? We did, but we can repeat that.
We've done 3. We've done 3. 1 was negative and 2 are still pending. We don't know the answer to those yet.
All right. But yes, there is a place definitely for the ER. Mild symptoms, mild respiratory symptoms are not the place for the ER. So please call your doctor first. And because we also know that we have elderly doctors in Wilson County. I did just turn 40, but it's not me. It's my dad. It's the other doctors we have around. So we don't want to put them at risk if we don't have to. So please be very careful and make sure that you're protecting yourself, but you're also protecting the people who are trying to protect you. That's a shout out to my dad, who doesn't have Facebook, but I see my mom.
So
that's
sure.
good. All righty, last call. It's like the bar. No, don't go to a bar. It's wrong. Sorry. But actually, we've talked with our restaurants too. We're shutting down here, but we've talked to our restaurants, and they're understanding. They're working on ways to do takeout meals and things like that, and not have buffets. So again, our county is amazing.
They're
and
really doing great things
people
everywhere.
understand,
Everyone in the county is taking it seriously and hopefully not panicking, and it really shows. Things are really going well.
All
So,
right.
thank you, everybody.
Okay, we'll do an air high five because
Air high five. And
so good.
thank you guys for joining us.
We'll see you next time. Oh, how do I turn this off? This is where it gets awkward because my face is in there and I don't know how to turn it off. Oh, jeez. You can't turn your phone. Oh, no, we're still live. Oh, it says finish. Bye, guys.